Good morning, everybody. Now, some people just can't give up the situation and the power they've had over the last 2 years. And we had last week a UK government advisor saying that we need to go back to wearing masks and not meeting indoors, only meeting outdoors. So that's Dr Susan Hopkins, who is in the what was Public Health England. It's now the UK Health Security Agency. That's what it's been renamed at. So got to remember that, because they keep changing the names of these agencies and quangos. So you don't really know what they're doing all the time. But that's what she's said last week. Now, we've just got rid of almost all the restrictions that we've had over the last 2 years, and quite rightly so. My view is that we should never have had them. We should have just kept going on as normal and treated people with symptoms of a disease with the treatment that they need to get, which I won't mention on here because of the algorithms, but you can probably think of something beginning with I and something beginning with H. Good stuff to treat viruses. Now, so she's come out and said this. Look, if she wants to wear a mask, oh, knock yourself out, Susan. You're very welcome to wear a mask if you want. I mean, before 2 years ago, no one in the UK wore a mask apart from a few Chinese students who were here. That was kind of their thing. Whatever, up to them. If they want to do that, they want to do that. But right now, we don't need to do this. And there's no evidence that it works as well. Even when they were being rolled out and the government was saying, okay, now you have to wear these things on your face, there was no evidence that they protected the wearer. So they even said there's no evidence that it prevents infection, but they were saying there is some evidence that it prevents transmission. But the only paper I've seen on that is something that was in the Lancet in January 2020, I believe, or maybe January 2019. I don't know. It was in the Lancet, and it was a study. It was over 300,000 people, so that's a large sample number. But it wasn't a proper scientific study. It was a questionnaire that people had responded to voluntarily on SurveyMonkey.com about their feelings about masks. Well, that's not science. That's not observed data. And in fact, in that article in The Lancet, it actually says, look, if you really wanted to do a proper scientific trial, it would be very, very difficult, and it would probably be unethical, because the only way you could really find out if wearing a mask prevented transmission or not is you'd have to get two people with a virus who are suffering, who've got symptoms, and you put them in two different rooms. And one of them you'd give a mask to, and you'd make them wear that all the time, regardless of whether they had difficulty breathing or not. And the other one wouldn't wear a mask. So they'd be in two different rooms, one with a mask, one not with a mask. And then you put like 100 people who were symptomless, healthy, whatever, in each room. And then you'd leave them for a week. You wouldn't let them go out of the room, whatever. You give them food and you give them water, etc., so they would survive and they get all their basic nutrition. But you wouldn't let them out of the room because you want to remove any other variables in the experiment. And then you come up after a week or 14 days or 28 days, and then you'd look in the room and you'd see how many of each, the 100 people in each room had developed symptoms of the virus. And then you could say, okay, well, the room where the person was wearing the mask, there are more, or there are fewer, or there's the same number of people who've gone down with it, and therefore we can make a comparison of the transmission. Well, no one would do an experiment like that because it's absolutely unethical and nuts. The only person who would do something like that would be Mengele or someone like that. you just wouldn't do that with live human people, because some of them are going to develop the virus, and they're going to get ill, and some of them might die, and then you certainly wouldn't want to cover up someone who's suffering with a mask and force them to do that. So you simply can't do a controlled experiment that is a valid and reliable experiment without doing something that's very, very unethical. So there just isn't the data on that. So that's why, even though when they say, oh, you should wear these things over your face, these face nappies, these face coverings, there's no evidence that they actually prevent transmission, because there hasn't been a double-blind, controlled scientific study on it done. So I've never worn one, and I think they're ridiculous. And, Susan, whatever. No, thank you. Not going to do that again.